Let's start with you introducing yourself and talking about your experience as a field epidemiologist, your training, and some of your professional experience from when you were trained to date.
Dr. Charles Akataobi-Michael. I'm a field epidemiologist, and I'm very proud to be one. I was trained in the Nigerian Field Epidemiology and Laboratory Training Program between 2012 to 2014. I was one of the cohort 4 residents, graduates, I would say. And for me, I think field epidemiology training shaped my perspectives, my career, and has enriched me immensely with respect to supporting population health. And I think of all my professional trainings so far, the fellowship training stands out significantly as one of the most impactful for me. Okay, so I'm also an alumnus of the impact of the US CDC impact program, Improving Public Health Management for Action. And so post training, actually, I had worked significantly in vaccinology. I'd worked with Affinet through the US CDC funded National Stop Transmission of Polio program. At the time I started working was when we had peak white polio virus circulation in Nigeria. And Nigeria was one of the endemic countries that was one of the 3 endemic countries that was preventing the world from declaring a polio-free world. Okay, and one of the things we did as field epidemiology was to follow the trajectory of the white polio virus. Significantly, we noted that there was a unique population that was actually seeding the infection. And this was a population that was hard to reach with basic health services, despite the fact that access to health is a fundamental, equitable access to health is a fundamental human right from my perspective. So what we did uniquely was to develop a nomadic vaccination program, many of which we've written up in journals. To do that effectively, we were able to enumerate these nomads because of their nature, their pastoralist in nature, because of their nature of movements, and the fact they don't move on conventional road tracks. We had to try to track them, map where they stay, map their movement pattern, and then align them with the conventional immunization, polio immunization campaign. And significantly, you'll see that with the inception of that program, which was led by field epidemiologists, we were able to stem the burden of white polio virus actually in Nigeria. And Nigeria became polio-free, white polio virus-free. And we're hoping that we'll be free of all forms of polio in the soonest possible time. So basically, I supported that program significantly for 9 years. Yeah, and beyond that, I supported strengthening health systems in Nigeria, working closely with the National Primary Healthcare Development Agency, where I supported development of immunization strategies, introduction of new vaccines, and everything that has to do with disease control and immunization from a preventive perspective. Okay, and then I also worked closely with the Nigerian Center for Disease Control, where I supported the Ebola response in Nigeria in 2014, and I also supported significantly the COVID-19 pandemic response, where I was part of the Presidential Task Force and I led the surveillance and epidemiology arm of that response. Okay, working closely with other colleagues and other persons. And when the vaccines came, I was in the highest decision-making group that determined how best practices to be able to ensure effective access and of the COVID-19 vaccination. As much as possible, many of the vaccines we received at that time were near expiry. So we had to actually develop significant strategies to ensure the optimization of those vaccines and reduce wastages as minimal as possible. So that's me in a nutshell. But suffice to say that I have moved up gradually and currently works with the Africa CDC as a senior technical officer, and I work in the Eastern Africa Regional Coordinating Center in Nairobi, and the scope of my work covers 14 member states of the African Union in East Africa. And primarily, I support everything that are cross-cutting activities with respect to disease preparedness, prevention, and response. I lead the Regional Integrated Surveillance and Laboratory Network, and currently I also lead the Climate Change and Health Program in Africa CDC. Although it's a new program, I'm happy that I'm at the inception, and we're working to see how we can build a continental climate change and health program, because that's the next place to focus on.
Thank you, Dr. Charles, for sharing that very broad, very detailed summary of your extensive experience. The first question I wanted to ask you is, what are emerging pandemic threats?
Large-scale outbreaks of infectious diseases, okay, with resultant morbidity, that is sickness and mortality, okay, over a large geographical area. Significantly, the way it's defined currently, because there's what we call epidemics and there's what we call pandemic. Pandemic usually is the way it's currently defined, something that have a global potential to cause disease. Yes, a very broad, multi-country exposures. Yeah, so when you talk of emerging pandemic threats, there are infectious agents or pathogens that have the tendency to induce the occurrence of pandemics. Okay, and we saw that recently with the COVID-19 virus, which caused a global disease with significant impact not only in health but in trade and movements of populations. So emerging pandemic threats are scenarios where we have pathogens that threaten the health and well-being of the global population. And so all the pathogens that have that potential are classified as emerging pandemic threats. And there is this saying that is common currently, that we are not saying, will there be another pandemic? We are just saying, when will the next pandemic occur? Okay, so that is basically what emerging pandemics are. And then we've seen it recently with diseases. So emerging pandemics can be in terms of new pathogens, which have not been in existence, but suddenly coming up and having the ability to cause mass disease that could result to mortality. It could also be existing, and that is when we talk of re-emerging. It can be existing pathogens that have developed significant potential to cause greater infection. So their infectivity rate might have gone far higher, or prior to now, they come as mild diseases, but for whatever reason, they become more virulent and then are able to cause more harm. Yeah, so those could be emerging. Yeah, and suffice to say that it is worth noting that 75% of these emerging and re-emerging diseases are attributable to zoonosis. Zoonosis are diseases that can be transmissible from animals to humans, and sometimes vice versa. Yes, exactly. So suffice to note that. So you see the monkeypox that is already ravaging. You see that both Africa CDC and the WHO have defined them as public health emergencies of concerns. So these are, and you can see that hitherto, monkeypox used to be known to be limited within certain geographical climes, but you can see now significantly from 2021 to date, this is the second time it's been declared a public health of international concern, or a public health of continental security. So these are some of the things. You talk of influenza, you also see influenza of different types. We see the SARS-CoV, we also saw the COVID-19, we've seen normal flu, that sometimes become more virulent, and so those are, you can say those are emerging. And so what you need to do when you know that these things will occur, because the trajectory of events, when you look at pandemics historically, I was just looking at between 1800 till date, we've had about approximately 20 pandemics, okay, with some pandemics causing a mortality of up to 100 million population, okay, and the COVID-19 one recently is estimated to have caused 27 million deaths. So you can imagine that proportion of people dying within a very short time, okay, due to this pandemic. So those are the kind of threats the world wants to prevent, and field epidemiologists should be seen to be proactively driving that. So that's what I think emerging pandemic threats are, and that's what we should look out for. So we also see cholera. So some of the pathogens currently that are being implicated as either emerging or re-emerging. You can talk of influenzas. You've talked of the Ebola virus. We've seen different types of Ebola virus. We remember the Ugandan Ebola virus. Okay. Yeah. So you've seen the mpox I talked about. You've seen the COVID-19. You've seen influenzas. Okay. You see. Yeah. So all of these are organisms. Dengue fever and all of that. Yeah.
What is the relationship between climate change and emerging and re-emerging pandemic threats?
That relationship comes from the relationship between climate change and health. I have, as an advocate of climate change at the health interface, defines health as the face of climate change. Prior to now, all climate change discussion has been focused on the environmental and agricultural impacts, and little was being said about health.
Yes.
But it is worth noting now that health actually should be at the front burner of climate change discussion. You know why? Because everything that climate change does is actually typified in the health situation. Whether you talk of climate change impact on food, the overarching impact is food security, nutritional deficiencies, which culminate into poor health outcomes. Whether you look at climate change on the environment, the overarching thing is that the impact is on health. Because if you look at the triad for disease causation, there needs to be environment, there needs to be agents, and there needs to be So climate change impacts all of these three variables for disease occurrence. So climate change can alter the environment and make the host more susceptible to hitherto diseases pathogen that they were resilient to or adapted to. Climate change can alter the host. Climate change can also alter the environment, which affects the host. Climate change can also alter the infectious agent, such that even though the host is still as resilient and resistant as he is, the agent has become more virulent as a result of adverse climatic factors like increased daily temperature, increased and prolonged precipitation, and all of that. And you see, so that can enhance the multiplication, the virulence, and the infectiousness of the agent, making the host more vulnerable. Now, beyond that, climate change can also enhance the geographical range of hitherto confined diseases. And that is why you see in many climes, even in Kenya where I am, we're beginning to see malaria cases in hitherto malaria-free zones. Because of the modifying effect of climate change, the vectors that cause these diseases are beginning to thrive in zones where they were hitherto not able to thrive. Okay? And so you know that a 1% increase in daily temperature over a persistent time period, which is of course climate change, can actually alter completely the health dimensions and dynamics. And that is why we say that currently climate change is changing both the social and epidemiologic dynamics of diseases. Okay, it's what we know initially as determinants. We cannot clearly exclude climate change as co-founders in this setting, because climate change confounds all of this. Suffice to say, for example, in Africa, for example, where we contribute the least to climate change causes, but we suffer the greatest impacts to climate change impact on health. Statistics or available record shows that between 2001 and 2021, which is about 2 decades, we've recorded about approximately 2,121 public health events that have had different dimensions of impact on the populations in terms of morbidity and mortalities. Of this number, 56% has been attributed to have been climate change induced or exacerbated by climate change. So you can see that for any variable epidemiologically that can impact that magnitude or proportion of determining a disease occurrence or a public health event occurrence, it should be something that we should worry about. And that is why currently several bodies have defined climate change as the greatest existential threat of the world as it is now. Now, when you now combine climate change with developing antimicrobial resistance, that is a very bad combination, and that can predispose to the next pandemic quicker than it should have ordinarily happened. Okay, yes. And then beyond that, again, climate change is causing redistribution in the movement pattern of populations, because when you have, for example, drought in a particular place, sometimes communities migrate to areas where they can get, and then of course that also causes conflicts, because and so you still see injuries occurring. Okay, yes. So it's talked about HIV/AIDS. Recently, I was looking at the UNFPA's website, and they were talking about drought in Zambia, where they are saying that as a result of the hunger from climate change induced droughts in Zambia, there is increased able to promptly detect, adequately prepare, and then also respond effectively to disease occurrences when they do. And when they do this thing effectively, the probability of the occurrence of a pandemic will be reduced significantly, because early detection, you can now look for ways to contain spread, and then you can alert the system, and people are more able to contain it. But because of climate change, these abilities are being undermined. For example, if you want to take a preventive measure like vaccination and there is a flood, some population get cut off during a mass vaccination campaign. I had that experience in Nigeria, in Benue, where flood caused the displacement of populations that have been mapped out for vaccination. We've developed a micro plan for them. We've planned for them adequately. We knew their household, we had numbered them, we know how to reach them. But suddenly, before the implementation of the campaign, there was prolonged precipitation rainfall, resulting in flooding. The population was completely dispersed. We don't know where to meet them. So that campaign happened, and the coverage was very low. And it was a measles campaign. Shortly after that response, we had outbreak of measles. So, now people will be triaging what caused it. People's mind will not go to climate change and how to create adaptation and resilience to climate-induced impacts and all of that. People are not factoring climate change intelligence in deciding programming for early warning system. They are not also factoring climate change in developing response program and preventive measures, which is what we need to begin to think about, okay, going forward, yeah. And field epidemiologists have a significant role to play in these areas.
What role can field epidemiologists play in addressing climate change and emerging threats affecting vulnerable populations?
Field epidemiologist, I'm really very happy to be in this zone because it has opened my mindset and broadened my horizon in terms of looking at disease epidemiology. Whether you're looking at infectious diseases, non-communicable diseases, or generally public health events that can induce injuries. And why do I say this? By training, there was little thought about climate change. I did a bit of environmental health courses and even did a short course during my fellowship program that one of the our facilitators brought from University of Ibadan. But even in all of those, climate change was not a major discussion. And I think that I will allude that to what I had said earlier on. Climate change discussions have been significantly not about health, okay? But now I think there is that awareness that is consciously coming to fore. Recently, I was in Lagos for a summit, and that summit was on climate change and health, the role of the youth in taking action. So I can actually tweak it to climate change and health, the role of field epidemiologists in taking actions. And what actions can field epidemiologists take? Now, field epidemiology training helps us to be able to prevent and respond to outbreaks, diseases, and public health events, ensuring a better health and well-being for the population, okay? And so by tracking the determinants of health or what could cause a disease, we're able to stop the gap in. Now, for me as a field epidemiology, I think it would not be effective if we try to address the determinants of health without looking at climate change. And so in the first thing I would say, the opportunities for field epidemiologists, there needs to be more evidence generation. And field epidemiologists, one of their critical outputs as bound volume is secondary data analysis, surveillance system evaluation, there's a third one, outbreak investigation, amongst other critical reviews or abstract reviews, manuscript reviews, and then of course their core research area. Now I'm thinking that field epidemiologists need to look at what is the evidence that is available in terms of the linkage between climate change and health. We do know that there's that linkage, but to what magnitude? We've not been able to effectively quantify that. And sometimes when you don't quantify, you're not able to generate the right information for informed decision making, especially to policymakers. So field epidemiologists have a great opportunity to do researches that are inclined towards climate change. Okay? One of such researches is every day we hear of weather forecasts. Prior to now, I never really took the weather forecast as anything. Even on our phones, you have apps that will tell you that the weather today will be hot. You don't read any meanings to it. Sometimes you don't even look at it. We just go by how we feel about the weather. Yeah, when we go out and it's hot, we feel it's hot. When we feel cold, we take a jacket. But we don't know the long-term impact of all of this in disease dynamics. Okay, so we hardly would think that way. So one thing we can do is to model meteorological data against epidemiological data and see the interfaces. What is happening between these two data, and how can we harness this intelligentsia for early warning systems to become more able to predict, detect, prepare, prevent, and respond to outbreaks. Epidemiologists need to do that. And for them to do that, I'm thinking that there needs to be incorporation of climate change. In short, one of my colleagues was telling me climate epidemiology into the training curriculum of field epidemiology training, because it's a critical area to look at. That's one. Two, another thing is to create awareness. Recently, I was speaking to colleagues in Cape Verde, and by virtue of their environment, there are certain climate risks that they are exposed to or threats, which has implication for disease burden generation. If you take, for example, antimicrobial resistance, when we do not dispose health waste properly and there is flooding, these things get washed from one location to another location. And now, most infectious things from the hospital are often harbor antimicrobial resistant organism. So you see how that resistant organism have moved from one place to another. We've seen that significantly with polio, where wash off from rain can actually cause polio, which was exist because we see some genetic peak typing of polioviruses, and you see a poliovirus that happened in Zamfara being detected in Chad. Sometimes we say maybe people travel with this, but some other times it could be wash off in water of those things, you know. So we need to create more awareness about climate sensitive health system. Our health facility should be climate sensitive and also be climate adaptable. Okay, in terms of their the carbon generation, we want to have a zero carbon health system where, as much as possible, we do not contribute to climate change causes. That's one. Now, so we can look at it from both the cost, what we can do to reduce climate change effects and what we can do to reduce the impact. If we cannot reduce the effect, we can prepare the population and our health system to become more adaptable and more resilient. Another thing field epidemiologists can do is to do what we call vulnerability and adaptation assessment on climate change. There are tools that are available on WHO website on VA assessment. They can look at that. You know, some of the things that we do as secondary data analysis, we can actually do scoping reviews in communities to find out what are their vulnerabilities with respect to climate change. What are the adaptation opportunities in that community? Have these two been linked to be able to make those communities more resilient or resistant to climate change impact? If a community is living very close to the Sahara Desert, the climatic factors that community will be predisposed to and the risks and the threats will differ from a community that is living at the brink or of a watershed or at the bank of a river. So we need to create those kind of awareness across this community. But much more importantly, as field epidemiologists, we need to build our capacity as individuals, because like it said, you cannot give what you do not have. So that's another thing we can do. So we can become good advocates. We can actually look at climate change related impact on health, what gaps exist, and then we can look for organizations that have whose vision is geared towards bridging such gaps and create a linkage between the areas of gaps and organizations that have resources for it. Field epidemiologists can create that kind of collaborative linkages and then help to mobilize resources to be able to solve those problems. We can build capacity, our capacity first, capacity of health teams, One Health coordination, strengthening One Health coordination. Like I did say, 75% of emerging and re-emerging pandemic threats or diseases are zoonotic in nature. So the more we begin to look at health, not from the lenses of a solo profession, but from a broader spectrum of multidisciplinary individuals coming together to engender the health of the environment and the people who live there, and the animals too. Because if the animals are sick, it's a threat to the humans, okay, and vice versa. Exactly. So we need to begin to think from the perspective of One Health. How do we collaborate? How do we harness our different skills to be able to optimize available resources? How do we create synergy around what is currently existing? These are things that field epidemiologists can do, and those kind of things. Yeah. Then, of course, they can also look at how do we develop curriculum to include information on climate change and health, especially for health-related institutions that provide. Because recently, was it 5 days back, a colleague of mine made a presentation in UCH for clinical practitioners, and you'll be shocked at the depth of knowledge with respect to climate change, even among medics. Okay, and we see that knowledge varies by specialty. Those who are in public health are more likely to think towards climate change, but you'll be shocked that people who should know do not really know. And so we keep working on the disease agent, we keep working on the host, but we're not adequately catering for the environment. And so these are some of the things that we can actually do.
Thank you for that, Dr. Charles. I've noticed that you've touched on some of the key knowledge gaps of our understanding of the interaction between health, between emerging pandemic threats and climate change. Could you also talk about what research priorities can help us address those gaps?
So for Africa specifically, let me come back to our zone. We know that the environmental health related issues cause about approximately 23 million or so deaths, if I'm not mistaken. Now, and it causes this through various means: non-communicable diseases, heat stress, outbreak of cholera, waterborne diseases, vector-borne diseases, and all of that. But for Africa, most of our issues are infectious diseases. Okay, so some of the evidence at the Africa Center for Disease Control and Prevention, we've identified 4 key thematic areas of greatest needs. Okay, and one of them is zoonotic and vector-borne diseases. How does climate change impact the occurrence, the burden, the distribution, and the dynamics of zoonotic and vector-borne diseases? Understanding that can help us to better mitigate the occurrences of those, or reduce significantly their burden, or even build community perspective for preventive measures. So that's one area. Another one is waterborne disease, and I'll take a case study of cholera. Recently, in East Africa alone, there had been significant cholera outbreak in the last 1 to 2 years. Okay, and it was actually protracted. In a place like Ethiopia, you saw prolonged outbreaks for a very long time and high numbers. In the Eastern Africa, for example, 50%, that is 7 of the 14 member states, had recorded outbreaks. Now, and we do know that one of the major drivers of cholera is the absence or shortage of water. Now, climate change has impact on this. What do we know about the impact of droughts on the occurrence of cholera? Are there gender dimensions to it? If there are gender dimensions, which population is most affected? Where should we channel our communications? So these are evidences that are necessary to be able to inform action. Now, if there are gender dimensions, are there also social demographic dimensions that relates with age, people's income, and all of that? Of course, these have some of the established ones, but we need to bring this body of evidence together as it relates to climate change. Has there been more burden in areas with climate change impact as against areas without in similar geographical settings? So these are things that we want to want to open up and then see what are the issues, what are the specifics. Okay, what can people do differently? What are their perspectives? Are there sociocultural behavior that are predisposing to the occurrence of climate change? How can people change? For example, we know that people cut down trees The trees provide a balance in the ecosystem. One of the key drivers of climate change is increased greenhouse gases emission, of which carbon dioxide is critical. Now, nature is so organized that whereas we humans and animals utilizes oxygen for metabolism and exhale carbon dioxide into the atmosphere, the trees or the vegetations imbibe this carbon dioxide, convert it, and give us oxygen. So you see that balance. Now, when you cut down the trees, there are no trees to mop up the excess carbon dioxide. What it does is that it begins to cause global warming, it causes increase in temperature. Yes. So it looks like there's a blanket around the earth that is increasing the temperature. And with this increased temperature, there is the melting of ice in the poles, and this melted ice go into the ocean, and then they flow in large volume, and then there is flood and all of that. That's just what climate change is all about. And then when it comes to our zone, there's increased rainfall, there's flooding and all of those. As flooding occurs, cholera pathogens are washed out to different places, the gutters are blocked. So it's actually a catalog of effects. So we need to generate those kind of evidences to know what is happening and what we need to do going forward. One of the things we're trying to do in Africa CDC is to develop a continental strategy for climate change and health, to be able to guide a tailored focus on what we need to do going forward, at least within a significant time span. And then after that time span, of course, we do continue to monitor, but after that time span, we can reevaluate what are the new emerging issues and how do we re-strategize on all of those. So evidence generation is critically necessary to be able to build resilience and adaptation here.